everyone, and welcome to our second live stream with OT Genius. I'm Jessica, the creator of OT Genius, and I just want to reiterate that the purpose of OT Genius. Hey, Andrew, what's going on? Thanks for joining. This is my friend Christy, but I'm going to go ahead and continue. And the purpose of OT Genius is to basically provide pre-occupational therapy students with the mentorship, guidance, and resources necessary to get into occupational therapy school. If you saw on the post in the group, I put that I was going to be talking today about the differences between post-professional programs for occupational therapy students, the difference between entry-level and master's versus the doctoral programs and stuff like that. And I figured I would invite my good friend here, Christy Bertrand, because she is going to the top OT program in the country, Boston University. And she's going to be telling us a little bit about just her experience as a post-professional student, as well as her getting her master's at Florida International University. So I have a very basic question for you. How did you decide to become an OT?
So hi everybody, my name is Christina. I go by Christy. I've been an occupational therapist for 3 years now. I'm going on my 4th year of practice. How did I decide to become an occupational therapist? So I have a brother who has an intellectual disability. He sustained a brain hemorrhage grade 2 at birth. So I was pretty much surrounded by therapists most of my life. And when deciding on careers, I thought of careers that I wanted that pretty much dealt with helping individuals who were less fortunate than I was. OT pretty much fell in my lap. I took a career exploration class at the University of Florida where I got my bachelor's. And yeah, from there on out, I went to volunteer with an OT, and here I am many, many years later. I love it. It is the best career ever. So if you're even considering going into OT, I highly recommend it.
Did you ever think about doing PT?
Yes, I did. I was between OT and PT for a couple years, actually, when I was at UF. I volunteered with both professions, but OT seemed like a better fit. Occupational therapy is the type of career, it really is what you make it. If you are creative, this is definitely a career for you. You can pretty much make any type of activity therapeutic. And yeah, so I was in between for quite a while, and it wasn't until all the signs kept leading me towards OT that here I am now.
So, oh, somebody else joined. Javier, what's going on, my friend?
Hi, Javier.
So, what then made you decide between PT and OT, though? What was the deciding factor that you're I want to pursue OT?
It's a good question. So, I volunteered at a pediatric outpatient center. Oh, you're a winner. Go you!
Yay! You're a winner too.
So I volunteered at an outpatient pediatric center up in Gainesville. I got to volunteer with actually all 3 types of therapy: occupational, physical, and speech therapy.
Very cool.
But occupational therapy really seemed like more of a fit for me personally. I have friends who are PTs and it works for them. PT, I would say, is a little bit more black and white. They work on obviously strength, gait training, things like that. OT really gets to hone in on those functional skills and make pretty much any activity creative and fun and really meaningful for the patient. So I love it. Really can't complain. Oh, thank you. We're both winners.
Thank you, Javier. Awesome. So how did you then decide what program, as you were looking into OT schools, what program was right for you?
Also a really good question. So I think for all of you that are pre-OT, every program has its pros and cons. Like Jessica said earlier, I am a post-professional occupational therapy doctorate student at Boston University now. But I did complete my master's at FIU, at Florida International University.
Go Panthers!
I am born and raised here in Miami. So when looking at programs, I really wanted to come home. That was a really big deciding factor for me. However, I strongly suggest that each of you that's looking into OT programs now to look at the curriculum, see what the focuses are for each program. Some are more research-based, others are more clinical-based, depending on the type of university you go to, whether it's a private institution, public, Research One institution. I know for us, FIU was very research-based. They are a institution that pumps out research continuously. So that is a bit of a deciding factor when looking into programs. But for me, it really came down to I wanted to come home after being away for many years. And yeah, FIU seemed like a great fit. I don't regret it at all. It was a great program. But each program is different. The BU program is very different than what FIU offers, and each one has its own pros and cons. So,
and for me personally, because I went to FIU, again, just like her, I decided to go to FIU, number one, because I wanted to stay close to family, and number two, the price. You know, because we have in the Miami, South Florida area, there are a few programs that offer occupational therapy as a program of study, and that's Barry University and Nova Southeastern, FIU, and then Florida Gulf Coast if you want to go a little bit more up north. But the thing about more specifically Nova and Barry is that they're more expensive. And, you know, so I know that price played a huge role in my deciding factors. And I think that as pre-OTs, that's definitely something that you're going to have to look at, you know, because, you know, you do not definitely want to get yourself in tons and tons of debt for a degree, you know. Our profession, I know you see in like a lot of these magazines that, oh, it's ranked as like the top 4 professions to get into. It was just rated that by Glassdoor, and it's really exciting, and I love my profession, and that we're making 80 grand, you know, a year. But like, she and I will be the first one to tell you that that's not really the case. And that once you graduate, you're going to have to probably get a little bit more creative on how you make your money. So you need to learn skills that are going to be an asset to you, and, you know, that you can use in the clinic to build your clinic, to bring more clients in, and possibly even go into business for yourself, you know. So I definitely want to emphasize that.
Yeah.
But
I also think, to piggyback on what she said, it really comes down to when you go to look at a profession, you have to analyze all the factors. There are a lot of pediatric jobs, but a lot of, unfortunately now, we call it the PRN culture. Our profession has moved to a lot of per diem positions, 1099 positions, where they contract you per patient that you see. I'm fortunate where I work for a public hospital, pediatric hospital, so I am salary based and all that, but it took me a while to get there. Also, apart from all the universities Jessica mentioned, Kaiser University has now opened up Oh, Noemi!
Hi, friend!
What was I saying? Oh, Kaiser University has also opened up a OT program. So also, to piggyback on what she said, when looking at an OT program, Barry University, I know, has a distance program. University of St. Augustine has just opened a Miami campus for those of you that are looking for more options down here in Miami. And they have also a weekend program as well as a full-time program. And Nova, I believe, is full-time. FIU, I know, is full-time.
Yes.
It's a lockstep program. And but Barry and St. Augustine have weekend programs for those of you that work. So those are 2 options also for you to look into.
Thank you. So what, you got your master's, you know, then you decided to get your doctorate. What made you want to get into the doctoral program, and how did you conduct your research into post-professional programs for any post-professionals watching this, or and even any pre-OTs considering OTD programs? So
okay, that's a good question. So a post-professional program is different than your entry-level OTD. In 2027, I believe, we are moving towards entry-level OTD. So we are following in the footsteps of PT. PT is now a DPT degree. OT now will be an OTD. When looking at post-professional programs, of course, I do work full-time. I work over 40 hours a week. So I looked to see what would be flexible for my schedule, because I am doing my OTD while working, which is very intense. So for those of you that are already OTs that are considering a post-professional OTD program, one thing I do recommend is finding a balance early on. But I did, so when I was in undergrad, I had always wanted to go to BU. I go to Boston University, like Jessica had mentioned, and they are top for OT programs. They're one of the best universities. If you do have, especially to go into an entry-level OTD program, they've already phased out their masters. So they only offer entry-level OTD programs now.
And that's where our culture is heading.
Yeah. So for those of you that are looking for a fantastic program, they are the best. You learn with some of the most renowned professionals in what we do. Professors who wrote some of the assessments that we conduct. So it's fabulous. I love it. I looked obviously at price. BU is actually really affordable considering it's a OTD program. They have a merit scholarship that each of us get as soon as you're admitted.
Affordability. Look at affordability.
Yeah, so they have a merit scholarship. I know for the post-professional program. I don't know about entry level, but as far as post-professional programs, they have a merit scholarship that each of the students get. So when I was looking at that, the price difference between, let's say, them and one of the other universities I looked at was Eastern Kentucky University, which is cheaper as far as getting an OTD. They were more or less the same in price, maybe a few thousand. So I wanted to go to the best, and I'm very happy I did. It's a great program. I recommend it hands down. And I think also you should look and contact the program directors of all the post-professional programs. I did, just to see what the curriculum is like, really, because when you go from a master's to an OTD, they look at what curriculum you took in your master's, and then some courses count and some don't. So you might have to retake, depending on the university curriculum, some courses. So that was also something I looked into.
So would you suggest that pre-OTs go straight into an OTD, considering that our profession is heading that way, or would you still recommend the master's and then a post-professional later on if that's what they decide?
I'm biased because I did the master's and then the post-professional OTD. So it could go either way. I honestly have my concerns with students who are, bachelor students going into a doctoral program. The level of thinking is on a whole other level. And at least for my program in particular, some of the questions that they pose when we have what they call Socratic seminars are about practice-based theories, practice-based patients, measures, things that we use on a daily basis in practice. So, I don't know I'm not an entry-level student, so I don't know the way the programs are designed. I just know for me, definitely getting a master's and practicing for a few years before I decided to go back to school helped a lot. They've already said, if you get your master's and you are a licensed occupational therapy professional, you will not have to go back to get the OTD. You're grandfathered in is what they called it. So for me, I just happened to be doing the OTD, and that's great, but most of the people I know aren't. They have masters.
I have a master's only.
Yes. And just like way back when it was a bachelor's, those people who have bachelor's degrees who are still practicing today were grandfathered in, and they need to get the master's. So
you don't need to get an OTD in order to be an occupational therapist right now.
Yes. So it depends on where you go. Like I told you before, BU phased out their master's program.
Right.
And most universities are headed in that direction. They're just refining the curriculum. So I love the way I did it. It's a lot of work, like I said, to work and go to school full time. Your social life really takes a dive, but it's worth it. And to me, getting an OTD, I looked into it in the first place because I wanted to teach, and I want to teach in the future. I want to inspire others with the career that I love so much. I live, breathe, and sleep OT. OT helped my brother significantly, and I'm eternally grateful to all the therapists he had. But I want to inspire the next generation of occupational therapy students. So that's really the reason why I did it. I love clinical research as well. I don't think I'm going to be a researcher, but it's something else that I liked. And, I feel like the more knowledge you have, the more power you have.
Definitely.
And we're the next generation of advocating for what we do and really differentiating what we do versus what, let's say, an academic tutor does.
And I was just going to say that as far as like the OTD goes, one thing to even think about, and she can chime in on this is just my opinion, okay? I personally think that right now an OTD is more than what the profession really needs. That's just my opinion. There's a lot of controversy on that. And I say that because, I was told by a physical therapist that one of the main reasons why they decided to go the doctoral route is because they wanted to get more research into to create more evidence-based practice, and they thought that by moving the profession to a doctoral level that they would get that. And that really wasn't the case, because people were not getting into PT school to be researchers. They were getting into PT school to be PTs, and now we're heading that direction. And a lot of us are not wanting to go into OT school to be researchers. We're wanting to go to OT school to be OTs. And so I think that, by doing that, I think that if you want to do research and that's your thing, an OTD program is great for you, especially if you want to be a professor in the future, which is why I'm considering a post-professional degree later on in the future. And that's why she's getting one right now. So I would say that that's the main thing. Look into your programs, look at affordability, look at what's most important to you. Whether, it's location, price, even the program itself, is it going to offer what it is that you're looking for? Because if you're not interested in being a professor in the future, then there really probably is not much sense of you trying to get an OTD. And a master's right now, at least until it changes in 2027, is not, it doesn't make sense at the moment. And you'd be spending extra money on that. So yeah, I would say those are the differences, and look at whether it's post-professional, entry level. Is the master's already been phased out of that university?
Yeah, and I feel like if you are a bachelor student going into OT school, you might want to also highly consider an OTD, especially if the option is available to you. Like if you're in Boston or up north and you want to go to Boston University, they only have an entry-level OTD. So, there are cases where I would do it because it will save you money. So I did my master's. It was extremely expensive, and now I'm having to pay for more schooling. So you might want to look at that too. If they're going to phase out the profession anyways.
That's true too.
In our case, Nova, I don't know if they've completely phased out the masters, but they're already offering an entry-level OTD. University of St. Augustine, the Miami campus, offers a master's. I believe Kaiser's does as well, and FIU hasn't phased out the masters. So it really, I think, also depends on where you live. BU was on it, and since they are, top tier in what we do, and they're the leading university in research and in OT practice, they immediately changed over their curriculum and now only offer an entry-level OTD. So that's something else to consider, where you are and what your universities offer. Also, a little tidbit for you guys is open house. So a lot of OT programs have either live webinars or even on-campus tours of their OT programs. I know BU just did one a few days ago. So, that's definitely also something to look at. What is the vibe that, do you feel like it would be a good fit? And I feel like with anything, whether it's school or job, you really have to see if you feel like it's the best fit for you. I went, when I went in for my orientation at BU for my post-professional OTD, immediately I knew I made the best choice and it was the best fit. So it's very personal, and I really think don't rush into anything. Really take your time. Make sure you apply early. Make sure you look at the big picture on what you want. And then that way you can make an adequate decision and give yourself the best option at succeeding, because the last thing you want is to, make a hasty decision and then end up unhappy. So that's my little tidbit.
Thank you for the advice.